Absolutely.
Thank you for checking in with us here. Oh, I see all kinds of things there now. But we're going to try to give some updates. I think as the agenda unfolds, um, you'll get a better idea of what's happening here at the health department. And as you can well imagine, these have been very busy days since vaccines began to arrive rather. So we will try to give updates on that as well. But financially, CARES Act monies have been flowing to the health department um, in COVID-19 efforts of just dealing with the virus. And now, of course, with the vaccines, we're able to invest those funds for vaccination clinics and the materials and so forth that go with that. We did purchase a new commercial grade refrigerator to store the Moderna vaccines and two temperature monitoring devices. And Lauren, if I'm getting a little ahead, you can tell me, but
You're fine. Go right
yeah.
ahead.
So those enable us to store the vaccines, and of course there's record keeping for all of that, as you can well imagine. I did receive a phone call from the Ohio Department of Health the other day with some questions on how we were handling the vaccines, the chain of custody, and security of the vaccines, and so forth. So, and for good reason, they're making sure that the vaccines are being kept according to the manufacturer's recommendations. So we received over $200,000 in our department for those type of expenses. We've had a couple other small grants, probably about 25,000, and we're looking at another sub grant with Richland Public Health for an additional 25,000.
Mayor, excuse me real quick. Are you guys just seeing that agenda, or are you seeing more of my other stuff?
I'm
You can
seeing a
see your,
map.
looks like your desktop right now.
You can't see the agenda?
No.
Not right now.
No. Okay.
That's fine.
We did for a second, Joe. It did pop up and then you went to, there
There
it
we
is.
go.
Okay.
There we go. So we've of course been. I'll just look down through there. Reporting, contact tracing, local clinics. So that's kind of under. I'm not so sure if Dr. Challa does not come. I'll just keep on rambling through there a little bit, because now it disappeared, Joe. Okay, there we go. Tiffany and Beth are at a vaccination clinic even now. So you probably saw in the papers we set up vaccination clinics out at the senior center. It's called a community and senior center now. We've got a contract with them renting that space out there, the Yetzer room. And most of those have been either morning or afternoon clinics. I believe as we get in now to the second shots, which we are in that phase now, as well as initial shots, that we're going to probably have all day clinics. We've talked with Tiffany about that. When you do the clinics, not only, of course, you have to get all the paperwork right and get everybody through, but then there's an input process that follows into a system called Impact and the immunization records. That all has to be done for each individual that gets the vaccine. So that's a process there that sometimes can be done simultaneously. Sometimes it's done following the vaccination clinic. I don't have the numbers right now. I believe it's over 600 or 700. But we are receiving more vaccines now. We were getting like about 100 a week. And of course, going through the age eligible citizens, we began to move through those as quickly as we could. We did get a larger shipment here this week for the follow-ups, which will really start kicking in next week. As you heard me mention to Monica, we're collaborating with the school systems here in the city of Shelby, Pioneer, St. Mary's, and Shelby School System to put on a large clinic on the 19th for teachers and staff of those school systems. We have about 325 that are on the books to get vaccinated rather. And so that's going to be quite an effort. We have 6 vaccination stations in the gym and looks like we'll be able to move that through pretty efficiently. This will be the Pfizer vaccine in this shipment. We're getting 500 doses of the Pfizer. Again, we're hoping to use 325 of those approximately for the teachers and staff. The other ones will need to move those through quickly and get those administered. Things have really been going well. We've never done this before in a pandemic setting. Just began to work our way through. We put folks who call on a waiting list, and then we call them back to make that initial appointment. And so we actually brought on a young lady to make those phone calls for us on behalf of the health department. We were inundated, as you can well imagine, when our numbers first went up, we made vaccines available. Steve, you can only imagine, you've been here at City Hall. Every phone became a health department phone because we were just basically taking names and ages and phone numbers. And so we had a list, I think at one time, of probably 600 or 700, but we've been working our way through that, again, age bracket by age bracket. So everybody did a great job up here. Joe was answering the phone himself and answering our questions. We got so many compliments of people saying thank you for. It's good to hear a voice on the other end of the phone and to have someone to talk to, and not some phone systems I think just were overwhelmed. They couldn't even answer phones, or they were just a recorded message. So they were very, very happy to get a live voice, at least explain a little bit. And we told them you're going to put on a waiting list, and it's a supply demand issue, and please be patient. So it has worked well in that system. We learned a little bit from the first round. The second time when we go through the initial shots, we're going to set up the follow-up shot right then. We're just going to give them that date and say, okay, 28 days later, if it's the right day, you got 4 days either side of that 28 for the Moderna. So we're going to say, here's your date to return. At this point, the first round, we asked them to call in to set up that date, and it's been like herding cats. So we learned on that one pretty quickly. But I think every health department learned what works and what doesn't work. Like I say, it's working well. Tiffany's been giving all the shots. We have some nurses that are lined up that they can give vaccines. We have used the firefighters for observers. They want trained medical people to be observers and volunteers at the intake table. So as I mentioned, on the 19th, we'll have 6 nurses here and 4 intake people and 6 observers to help to carry that vaccine through. I think that's a little bit more than a general update. I think, do you have something in here about the site visit? Okay. I wish I had those statistics on all this. We have,
let me see if I can find
COVID-19. Well, the last update I sent out, we have a little over, I can't get to my word now, but I think there's it seems to me a little over 700 total cases.
Yeah, so I just pulled up the report you guys posted this morning on Facebook, and it shows that we have 5 new cases since yesterday, a total for the city of 733, and 689 of those folks have attained covered or resolved status. So there's 16 active cases, it looks like, and 1 person currently hospitalized.
Perfect.
From the general population. You're welcome.
And that was actually over a 2-day period, I believe. That said 48 hours at the top right-hand corner.
Yes, it did. You're correct.
So that's a 2. We've been averaging, I know you can, about 2, if you 2 to 3 new cases a day, which is that's a good report for us. There were times when we have 8, 9, 10 in that one time period. We were averaging maybe 15 to 20 a day, new cases. So that's a good report to be down in those low numbers. And 1 hospitalization, you said, I think.
Yes.
Right, and unfortunately 28 COVID deaths, and of course our condolences go to you, Monica, for your mama there, being part of that,
Thank
part of
you.
that number. So, but I think our health department did well as a general overview of handling the pandemic. We're handling complaint calls, and that's a tough thing about masking and not masking, and we go out and try to educate retailers and restaurants and so forth. But it's like going into a civil war with a blue shirt and gray pants. You get shot at from both sides. So some people think you're too strict, and other people think you're not strict enough. And but we're trying to find that balance. But I think there's been more. To me, folks are wearing masks more, face coverings more. It seems like in the city that I've ever seen at this point. So hopefully, with the vaccines and sanitization and folks learning what's best for them, I think we're going the right direction. So does anybody have any questions in any of that? As far as money being spent, like I would have, I'm trying to remember. Lauren, if you remember any of those figures at all?
I know
would say,
go ahead.
yeah, with the refrigerator and everything,
Right.
I don't know. I'm thinking that it may be around $20,000, $25,000. I think perhaps we've spent or invested in this effort at this point.
Sounds about right.
Oh, and we will be paying the. We made up our minds we'd be paying vaccinators and observers, since they're medically trained people, and we could not do these clinics without them. So there's a $20 per hour for the vaccinators, and then $15 an hour for observers. We're using the firefighters right now, and now we checked into that, and we cannot pay them that rate, so they get paid on their day off for doing this work. But we're hoping to get some observers worked into our vaccine scheduling, to where we'll be able to have some medically trained professionals doing that at that $15 an hour rate. So now, are there any questions?
I just
Okay.
want to compliment the process. My mother-in-law went out to the senior center, and she said it was smooth and everybody did it wonderfully. And so
Oh, good.
there's one positive note. I'm sure you have many.
You know what, Steve? And that has been a really rewarding thing about this. Again, I think people appreciate the fact that we're trying to do something here, and I don't think I don't know if there's been. It's hard to believe. I don't think there's been one complaint actually at any of the clinics. Naturally, with there's been a little PR thing with the firefighters being out there, EMTs. They do a real good job of handling the senior segment. They deal with them quite a bit. Some of them recognize each other, and but the guys from the firehouse have just been real gentlemen out there and treated everybody courteously, and I think that's been a big part of it too. But yeah, it's gone very, very well. Thank you for that. Appreciate that. I'll pass that along to the girls. So did I cover everything, Lauren?
Yeah, I think you did. In the first couple sections, of course, because Beth and Tiffany are at the clinic today, they're not able to join us. So I don't know, as far as environmental health goes, Beth has been on top of and up to date on all the inspections and food licenses and all of those processes. So I don't think there's much, there's nothing really to update there other than that. I know that was a challenge getting some of the inspections done with closures and some establishments having to close temporarily if they had a COVID, people quarantined, staff, et cetera. So I think she was able to catch up on all those and work extra hard when they were available to get the required licenses and paperwork all finished. So.
Yep. Mm-hmm. And she'll be working more on, as the snow melts, things will begin to show up in yards and on porches. So those she gets some of those calls, you know, uncollected trash, and that's part of the environmental health issue as well. So her and Joe will be busy sometime later part of next month, I'm sure. I hope that's when the snow melts off at least.
Sooner the better. All right, you want me to cover the community engagement? Those last two sections are essentially accreditation related. Okay. All right, so I think we talked about this at our last meeting in November already, I believe. But we had been in the process of updating our community health assessment, which that report was finished in December, late December. We got it, I think, the 22nd. So that's an update of our previous assessment, which was done in 2016. And that was we were part at that point of the Richland County assessment. So we used the same company and that did that assessment in 2016, and they were able to update it. We were able to we had a grant of $15,000, I believe, from the Department of Health to fund our new CHA. And we were able to get that updated with roughly that same amount of money. I think it was $16,000 and our grant was $15,000. So that worked out really well. It is an update of our previous plan. We did not collect new primary data through a survey from our community. That would have cost $45,000 or $50,000, I believe. So we went the route of updating the plan for now, and then intend in 3 years to maybe start fresh and include new primary data at that point, or the survey at least. All the other data was updated with current information. So that document is posted on the website. We are going to do a news release to kind of announce that that's available and make sure it gets shared with everyone, this group included. Everything happened right after Christmas with people coming back to work and the vaccines and being at kind of that peak of case management, and Tiffany was busy with contact tracing. So and then vaccine planning. So there's been a lot going on at the same time. So we haven't pushed that out yet, but we will. The next step, one of the things we dealt with in January, though, the next step is to update our community health improvement plan. So that's the action items of, okay, we know what the status is of our community. What do we do to make it better? Which needs to align with the state health assessment and the state health improvement plan. We had originally intended to use HCNO, the Hospital Council of Northwest Ohio, to do that plan as well. Unfortunately, they've had some staffing changes and don't have currently the staff available that they could commit to that project. We found that out maybe the very end of January, that they weren't going to be able to work with us on that. So, and it doesn't look like they're doing any health improvement planning right now. They're focusing on the data piece, the assessment. So we talked about it internally and at our Board of Health meeting in last week on February 2nd, and we did decide that this is a plan we feel we can do internally. I think the quote we had been given from HCNO was around $13,000. So we feel like this is a plan that we can handle and manage to do in-house. So that's the route we're planning to take. There's lots of guidance available on how to planning models that we can use. And it kind of fits nicely, as we've talked to you guys in the past about wanting to kind of reformulate or restart that formally creating Healthy Communities Coalition, which that piece of it no longer exists. That was a partnership with Richland Public Health. But so we feel like those two projects, rebooting that local Shelby coalition of health focused partners with the health improvement planning process, which is by its nature requires more input from your community and collaboration, that will work really well together. Of course, because of where we are with COVID and vaccine clinics, and we're really at the height of managing two projects there with the case management that's ongoing and the vaccination program, we've decided that we're going to wait until April sometime, or late April, early May, to start that project. We need to kind of get through this next phase of vaccine and see where we are. We have our site visit coming up for accreditation, which I'll talk to you about next. And that would give us a point where we can catch our breath a little bit, have one project, hopefully accreditation, behind us, and then focus on the updating the chip with the goal of having that complete by the end of 2021, which we think is manageable. Once we get that completed, then there's a strategic plan for the department and a few other plans that would have to be updated, but we can't do that until those are due for updates. But we have to get that chip updated first, so those can all tie together, which is an important element for ODH to see, and also for our accreditation body to see as well. So that's kind of the quick update there on community engagement. Marketing wise, we've been trying really hard to keep the website updated and pushing information out. I think the mayor and Tiffany and Beth have done a fantastic job of getting news releases out with information about COVID case status and kind of where we are as a community. And that's been a really positive thing that people have, I think, appreciated. And correct me if I'm wrong, Mayor, we've talked about that before, having updated information about what the status was locally.
Yes.
So, anybody have questions about the child or the chip at this point?
No.
Okay, excellent. All right, so the last topic I have would like to just share with all of you today is our site visit. As you know, we've been working on our public health accreditation process for a couple of years now. We actually submitted our documentation, which was a huge undertaking, in October of 2019, and have been in the process of waiting for a site visit. We would have expected a site visit early in 2020, and then obviously COVID happened and everything got put on pause and pushed back. So I believe the last time we talked, we had been scheduled for a site visit the beginning of January. And unfortunately, what had happened with those dates was it was going to be the Monday, January 4th, 5th, and 6th. And we were right at the point of anticipating getting vaccine any day and starting that process. And with COVID cases at the height, and we really didn't have, there was just no way we could take 3 days of staff time and do a site visit and be prepared for that site visit, because it's certainly more than just the days of the conversation. So we did request an extension and to push that back a little bit. So our new dates are March 10th, 11th, and 12th. We felt that, and Dr. Chawla felt strongly that if we could get it in March, that would be enough, give us enough time to get everything else worked out and be in a flow of what we were doing with vaccines, which is what's happening. We're pretty much we're getting our sea legs under us and are feeling pretty comfortable with that at this point. So our site visit is the 10th, 11th, and 12th of March. We're looking forward to it because it's a huge, next step in this process. Most of the part is Beth and I talking to the site visitors. It will be a virtual site visit. So we will be in the conference room at the health department, but our site visitors will be at their home locations. And it's essentially 10 to 2 those 3 days. It's not the full day, but we have an agenda all broken down with the site visit team and know what we're covering when. Because they're doing all these virtually, they're not going through all 100 measures. They're going through the documents that they flagged and asked for additional information on, which we've provided. So we'll cover about half of those measures in our conversation with the site visit team. On the last day of the site visit, on the Friday, March 12th, the focus of that day is meeting with different partners and different people that work in the health department. So they will have a meeting with Mayor Shag as the Board of Health. They will have a meeting with Dr. Chawla and Mayor Shag together as the administration of the health department. And then we also at 11 a.m. on March 12th have what they call a community partner meeting. This will be via Zoom. And they ask us to invite 5 to 10 local partners that the health department has worked with in some way over in our programming, in our pursuance of sharing public health information with our community. So we have an invitation list, and that invitation is going out. All of you as advisory board members, we would love to have you there if you're able. It is a 1-hour meeting. It is max of an hour. It's essentially a quick discussion where they just ask a little bit about how does the health department interact with partners and the community. So it's pretty easy. I participated in it as a partner in another health department, and it was pretty laid back, pretty casual, and no pressure session. So we would ask if you are available that day, that Friday at 11 a.m. We would love to have you at the community partner meeting. You'll get the formal invitation from the mayor in the next day or so, and we can get the Zoom link to anyone that's available. We are offering to any of our partners that are willing and able to come that day, if you want to talk to us ahead of time, or we can have a little Zoom session ahead to just talk through, or you can ask questions on what might be expected of you, if anybody wants that. or isn't sure, but we have, so many partners, and that's always been one of our strengths, is working with organizations in our local community. It's one of the advantages of being a city health department in a small town. So, we hope that people will be able to join us that day. Once we get through the site visit and the timeline, there will be the site visit team will prepare their report. I want to say we should know in a couple of weeks what their status is. There's a couple options. They can either fully approve you and say you're accredited, or they can, if they identify some things they want more information on or they want you to work on, then they can put together, they don't call it an improvement plan anymore, and it escapes me what the title is, but they basically give you a work plan, or you create a work plan of saying, here are the gap areas, and here's your timeline for working on those gaps, and then they review it again, and then go through the accreditation process at that point. So, any questions about that?
What date was that?
It's
for that
Friday.
meeting?
It's Friday, March 12th
Okay.
at 11 a.m. And it's a tight schedule that day, all 3 days of the site visit. So it will definitely not be more than an hour. And if someone had to pop off the call a little bit early because they had another commitment or something, that wouldn't be a problem. I don't think that would be a problem at all.
I want to thank Lauren and Beth really worked hard on pulling together all this information, all those. How many sheets of paper do you think that you submitted?
At the original document submission deadline, which was October 3rd of 2019, I want to say we had over 686 documents that we had to submit. If you need multiple examples of certain things, a lot of things, and then you had to write an explanation or what they call a cover sheet. So it was, it took us 3 years, I think, if I remember correctly, Mary, it took us 3 years to get to the point of submitting our documents and being ready for that. And there's a pretty tight time frame that they give you once you trigger certain steps in the process. But it's a ton of work. It's a lot of work for a big health department. I almost think it's more work for a small health department because you still have to meet all the measures, even though you are a small agency and don't have, 30, 40 staff members putting things together and working on it or providing services to your community. So it's been a huge undertaking. Beth has been fantastic. We worked together a lot and spent a ton of time on this, so I couldn't have done it without her.
Mm-hmm. Well, yeah, and I can't even imagine trying to approach this without someone like you. And Lauren does she's very good at, I guess, distilling facts and figures and putting it all in readable form. And she has a great gift. And so I feel comfortable going into this with her at our side. And I would say too about the community partners, I think it'd be good for us to have a meeting before the meeting with the accreditation team. Because if I were on this meeting, like, Janine or Monica or Steve, I'd be wondering, well, what do I really know and what they might ask me? And we might be able to fill in a little bit more on, what those, that Creating Healthy Communities Coalition look like and what the new brand of it, as we were able to pull things together, look like with the library and the Shelby Y. We worked with the park systems even. For the smoking cessation signs and so forth. So I think if we fill in Janine and Steve and Monica, you'll have a little bit of better background. You'll feel your feet underneath you a lot better if we have a meeting before the meeting.
Absolutely, very willing to do that if that's helpful.
Yeah,
I would need like a week and a half notice just so I can clear my schedule.
Okay.
Because I usually book from 11 to 8 every day. Hour to hour.
And Dr. Leifer, are the afternoons like this always best, or is there a morning that am I hearing you, Janine, that if there were an earlier morning one, you might be able to make it?
I could do 9 or 10 much easier, but
Okay.
I can, if I have enough time, I can work around it.
I was just asking Dr. Leifer, thank you, Janine.
Monday and Wednesdays would not work in the morning, but Tuesday, Thursday, and Fridays would.
Okay, are you making notes of that, Lauren?
Yeah, you said Tuesday, Thursday, and Friday are best for you.
In the morning,
in
yes.
the
the morning.
morning? Okay,
9 or 10, right, Janine?
I can do 8, 9, or 10. I can
8, 9,
usually manage it. I do
Okay,
my own
just-
schedule.
sure, but need
Right.
as much. I'm just wondering if maybe looking at the calendar now, like Thursday, May, that's wishful thinking on my part. Thursday, March 4th, that's a week before the site visit. Would that be a possibility? The other one we could do is maybe Tuesday, the 9th. At like
It's
9
good for
o'clock.
me.
Okay,
I'm trying to get to my schedule.
sure.
The 4th looks okay to me, and the 9th.
Okay.
So Steve, you be okay?
They're both okay for me.
Okay.
And probably the earlier the better for you as well, right?
6 o'clock, we could do a breakfast one.
I'll bring the virtual bacon and eggs,
Virtual donuts.
virtual donuts and everything.
I could do either of those as well.
Okay. Okay.
Nine's fine.
9 is
o'clock.
okay.
9 o'clock.
9
Yeah,
a.m.
or
Okay.
whatever.
So
All right, well,
which would you prefer, the 4th or the 9th? Lauren, you think closer to it, a little fresher to the, little fresher or at the 9th?
only, I don't think, I think either one of them is fine. I think we should, the 9th is just the day before. I
Yeah,
don't
that's
know
too
if we
close,
have
yeah.
any last minute preparation we as a team internally have to do. So maybe we
Yeah,
should go
maybe
with the
the 4th.
4th.
Yeah, the 4th, that'd be
Okay.
good.
Let's go Thursday, the 4th at 9 a.m. We'll do that on Zoom like this.
Okay,
And if for some reason, Mayor, the city Zoom is already committed to another meeting at that time, I have one here that we can use
okay,
and I can
All right,
set it
very
up if
good.
necessary.
all
Okay,
right.
so we'll do just a brief, and that, I mean, we'll book it for an hour, but if we don't need that much time, that's fine. Just any questions, we'll invite the other partners who are able to come on the 12th as well and answer any questions and kind of get everyone ready for it.
Yeah.
We appreciate all of your time in this. It's been, we're at the last step, one of the last steps. So we're very
Yeah.
excited
And
and
we'd
a
like
little
to
bit
have a meet-
nervous, but we'll be fine.
And I would anticipate outside of COVID and vaccines and tracings and so forth, to be able to have meetings a little bit more regularly. This has just been, well, we all know, you don't need to describe it. But so we appreciate you being there and available, and we're hoping to get you plugged in. How would you say it, Lauren? I mean, just in a little closer knit fashion, I would think.
Yeah, I think, when we started the advisory board and we were, we had worked on a long time, the mayor had put a lot of effort into getting this group set up and put in place. And then we had our first meeting in February, the only in-person meeting I think we've had. And then all of this started and we had to kind of redirect. So yeah, I think we're all looking forward to being able to focus too on other projects and other activities of the health department.
Right. Yep. So is there anything we can do for you as board members that would help you more? I mean, you do get the notes of our meetings, correct? Lauren, you send those out
I believe
minutes.
Beth sends them after, but, because I don't send them directly, but I think Beth does,
Okay.
of our Board of Health meetings.
You all
if not,
been
we-
getting those Board of Health minutes and meeting notes?
I think
Maybe
maybe
not.
once I have.
Okay. So we just need to refine the process of how we make sure
Yeah.
we get those to all of
Let's-
you.
yeah,
Okay, we will look at that.
Because at least that would keep, we meet usually the first Tuesday evening or 4 o'clock of each month. And that would be a great help if we make sure everybody's getting those, kind of keep you up to date on things too.
We'll work on that and make sure it happens every month.
Sure. Great.
Mayor, is there anything with mental health that you guys track?
Didn't that pop up in our last meeting, Lauren? I thought there was a little element of that. But no, we're not really tracking
Right.
anything. And I was just on a Community Action Commission Zoom meeting before this, And they were talking about plugging in some of the mental health dynamics for their staff, because as you can well imagine, the Community Action Commission of Erie, Huron, Richland counties, they're just being slammed
Mhm.
because there are funds available and trying to work through that process. Anyways, they're overloaded. I think Joe Trollion was in touch with them in Richland County. But that's a long answer to a short question. The short answer is no. So are there any suggestions that you might have, or?
I don't know if I have suggestions. I think I have a lot of questions. I do know that our referral numbers are really high. You know, with everything going on with the COVID and just life in general, I'm seeing more and more teenagers with anxiety and social isolation. So the suicide rate, the self-harm rate, they're going up. And I was just wondering what we're doing in Shelby, you know, to kind of help that. Are we reaching out to the schools? I mean, I don't know.
This is,
You know, I'll see if the schools internally have been. I know it's always been a concern of Dr. Chawla of trying to get students back in school for the very reasons you mentioned there. That's been a focus of his. He's a firm believer they need that socialization. I don't know if the schools have been doing anything internally. I know they're keeping track of new cases and quarantines and so forth. Their nurse does at the Shelby City Schools. I'm not so sure they've been doing the mental health. And thank you, Janine, for bringing that up. It's a missing component at this point, I would say.
well, I
And a
think
huge component.
Mhm.
Yeah. Oh, yeah.
Well, I'm thinking to what,
You're right.
you know, things that are identified in our current community health assessment, the current health improvement plan, and mental health needs is a huge area in those planning documents. So I think, you know, in the broader sense, I guess in my mind, I'm jumping to that needs to be maybe a focus of this coalition as we rebuild this coalition, which we need to have a name for it yet, and we don't. You know, something certainly maybe pooling resources or trying to find ways to promote awareness, information, connect people with what they might need. That might be something we can work with or should prioritize with that group.
Right. Yeah, and thank you, Janine. I mean, you're right. I mean, we have just been so occupied in getting the vaccinations going, and the tracings were a huge burden on Tiffany. And then, of course, we had the outbreak at Crestwood. Now, we weren't on site managing that, but Dr. Chawla certainly was involved in that. So, yeah, that's something we need to really bring into focus here.
Perhaps going forward, mental health could be, you know, like a subcommittee of this group, because, you know, the issues won't be resolved right away, you know, so this could be ongoing.
Like that.
Just a thought.
Yeah.
That's a great idea.
I mean, we do. And Janine, are there private counselors, certified or otherwise? I mean, I'm somebody in Shelby, and of course the school has some, but I know you know, we have family life counseling, and there's Come to the Well counseling, was a faith-based counseling. But other than those two, are there folks that do counseling maybe similar to what you do in the Shelby area that I'm not aware of? Or maybe offline you can tell me. It doesn't matter to me.
But I have a office there on my home that I do on Fridays. But usually I work in Mansfield, but we are considering a move to open a satellite office in Shelby. That's something that we as Heritage Christian Counseling have been discussing, because I really see it as a need.
Right.
I know I've spoken to one of the supervisors at Family Life, and in November, they had 40 new referrals. January, they had 50 new referrals. And in order to meet that, they would actually have to hire more staff, more clinicians, because they're pretty booked as it is.
Right.
So I don't know if there's anyone else in Shelby per se that does like home counseling, but not that I'm aware of. And on
Right.
my Fridays, when I'm in Shelby, I'm usually booked.
Okay.
Wow.
Well, yeah, thank you for bringing that to our attention here. Yeah, we'll have to find a way to get that plugged in here. But it
And
is
I'll
part of
keep
public
you all
health, yeah.
updated.
Mhm.
I'll keep you updated if, as to what our agency is going to do as far as possibly opening in Shelby.
Okay, wonderful,
Great.
wonderful. Thank you. All right.
Right. Well, thank you, everyone. I don't think we covered everything on the agenda, so we're a little ahead of time. So that's great.
That is good. And the sun is shining. Go out and get a little tan. Just kidding. Don't try that.
They call that
Do
wind
that.
burn.
Wait,
Yeah.
yeah. There you go.
I think it would be today.
Oh,
Oh, mercy. Okay.
yes. All right. Well, thank you
thank you,
again,
Mayor.
everyone.
Thank you,
Thank
Lauren.
you.
You're
You're welcome.
welcome.
Thank you,
Thank
each
you.
and
All right.
every one.
Thank
All right,
you.
everybody have a
Have a
blessed
great
afternoon.
afternoon.
All
Bye-bye.
right.